If you're wondering which part of your penis is actually the most sensitive, you're not alone. Whether you're exploring your own body, trying to improve intimacy, or simply curious about how things change as you age, this is something every man over 50 should understand. Let's break it down, respectfully and clearly. Hey, I'm Dr. Zoe Hartley, and on this channel we talk honestly about men's health, aging, and confidence after 50. Today's topic may sound simple, but it has powerful implications for sexual function, pleasure, and even self-esteem. Let's get into it. 1. The glans, head of the penis. The glans, also called the head, is generally the most sensitive part of the penis. It contains a high density of nerve endings, especially around the tip and underside. For uncircumcised men, the glans may be more sensitive due to less friction exposure. Circumcised men may still have high sensitivity, but it can vary. 2. The frenulum, the true hot spot. This is the underside of the penis right below the head, where the glans connects to the shaft. It's often the most intensely sensitive area for many men. Even gentle stimulation here can produce strong reactions. If you've ever noticed climax building quickly when this area is touched, that's why. 3. The corona. The ridge around the base of the glans, called the corona, is also extremely sensitive. It reacts strongly to movement and pressure, especially during intercourse or manual stimulation. 4. The shaft, less sensitive but still important. The shaft contains fewer nerve endings compared to the head or frenulum, but it's still sensitive, especially near the base and sides. Some men report erotic sensitivity in specific spots. It varies person to person. 5. Other erogenous zones men overlook. While the penis is the focus, other areas like the perineum, area between scrotum and anus, inner thighs, and even the lower abdomen can heighten arousal when gently stimulated. Exploring these safely can enhance overall intimacy, especially as you age and sensations change. After 50, testosterone levels decline, blood flow may slow, and nerve sensitivity can decrease slightly. But this doesn't mean pleasure is gone. It just means learning your body again, what feels good, what doesn't, and how to adapt. Many men find that mental stimulation, communication, and new techniques become even more important with age. So, the most sensitive part? Usually the frenulum and the glans, but don't underestimate the rest. Understanding your body isn't just about sex. It's about self-awareness and connection. Like this video if you learned something new, and subscribe for more real talk on men's health after 50. Next, watch this one. What makes a penile strong? It could help more than you think.